Hi everyone, it's Dr. Tom Burge again from Enjoy Life Chiropractic and Laser Care in beautiful South Surrey, British Columbia. You know, if you're currently suffering from a soft tissue injury from a car accident or a motor vehicle accident, you will intimately know how disruptive the pain can be to your lifestyle. Not only financially and time-wise, but also the pain that's usually occurring with a whiplash type injury. You know, the goal of any conservative therapy is to reduce your pain as quickly as possible, promote long-term healing, and get you back to enjoying life. Stay tuned, and I'll just run through how we work with our patients in our clinic when they're dealing with a soft tissue injury from a whiplash type disorder. Okay, so let's start with what actually a whiplash injury is. Whiplash is just a generic term for the mechanism that actually causes injury to the surrounding tissue and muscles and ligaments that are in the spine. The whiplash occurs from either a quick and abrupt forward motion like this and then backward motion. And that can cause injury and trauma to tissues like the ligaments, the discs in between the vertebrae, the soft tissue of the muscles, the tendons, and can even cause disruption to the nerve. It eventually will lead to restriction of the joints in the spine, which we typically call a subluxation. Now, other symptoms can also occur. You can get headaches, you can get jaw pain, you can get dizziness from a whiplash type injury, you can get mood disruption. If it's long-term pain, it can even lead to depression, and sometimes it even cause pain down into the arm, into the hand. So there are a lot of symptoms that can typically go along with a whiplash type injury. So the very first thing that we do in a clinic when a patient is involved in a whiplash type injury is we do a very thorough examination. We want to determine what structures and where is the injury and what's taking place and what's causing the pain. We also want to be able to document the injuries just in case there is future litigation. Now, our examination will consist of a physical examination that's broken into postural exam, orthopedic, and neurological. We'll do computerized tomography and range of motion studies and an x-ray. And if we feel it's necessary, we can refer out to a private MRI to get further diagnostic and get further labeling of what the actual diagnosis is. Okay, so let's talk a little bit about what are some of the stages you may have to go through to help heal your whiplash injury. Well, the very first stage is usually what we call the acute stage, and that's when people are in the most amount of pain, usually have broad and wide symptoms, and typically will have decreased range of motion. And that's called the acute phase of the injury. Now, we'll try and work with the patient to reduce their neck inflammation, because that's usually what's causing the pain, and create as much soft tissue healing as quickly as possible. We'll use instrumentation like cold laser therapy that can be applied to the tissue area. It's very non-invasive, and it allows for a quicker, faster response to healing. This will control the inflammation, help reduce your pain, and speed up the recovery for long-term processes. And it's during this stage that we'll also do a little bit of light stretching, maybe some manual therapy techniques, and typically recommend appropriate movement exercises with ice and heat type therapies at home. Now, as you're healing, we progress through to the next phase of care, and that's called the subacute phase of healing. This is where the neck becomes less painful, the inflammation starts to reduce, and we want to make sure that at this stage that we start to introduce spinal range of motion. We want to make sure the motion is restored in the spine. And this can be done through a variety of techniques. Typically that's done through the hands, but you can also use instrumentation depending on the sensitivity of the patient, how the patient is feeling. And it's this step, I feel, it's probably the most important that a lot of patients miss during their whiplash therapy program. You see, the spine and the nervous system are intimately related to the brain and how it sends information up. And if we do not restore proper motion to the spine, the surrounding small muscles and the nerve endings in these joints do not send the appropriate sensory information to the prefrontal cortex. Now, what does this do? Well, if the information is not sent up because there's lack of mobility in the spine, it can cause further degeneration later on down the line. It can cause appendage issues, things like shoulder or hip, knee and ankle and elbow and wrist issues. So it's vital that we restore joint motion purely for the sensory information to go up to the brain. Now, it's also during this stage that we're going to give graded exercise programs, strengthening programs to shore up the muscles and the soft tissue that's been injured to ensure proper posture and make sure full tissue recovery takes place. Okay, I hope you learned a little something about whiplash injuries and how Enjoy Life deals with those patients that suffer from that. If you're suffering from a whiplash injury, whether it's acute, subacute, or chronic, or if you don't know someone in your family who has that type of injury, please don't hesitate to call us. You can phone the number at the end of the video or contact us through our webpage or email. Hey, and don't forget, make posture a priority and not a liability. Bye for now.